December is now upon us, and while we all hoped the pandemic would be over by now, the reality is that in many parts of Canada, the COVID-19 crisis is getting worse. In Alberta, where the government was slow to impose even moderate restrictions, case numbers are skyrocketing, and the strain on the healthcare system is becoming acute. Hospitals are running out of space and staff. Calgary hospitals have been told to conserve their supplies of oxygen. This is the path Alberta is on. In the span of 1 month, COVID-19 hospitalizations have more than tripled. As of tonight, there are 479 people in hospital with COVID-19, 97 of them in intensive care. Alberta did impose some new restrictions last week, but only modest ones. And because of the incubation period of the virus, it will take time to see if they have any impact. Alberta is nowhere near its peak. Today, the province reported more than 1,300 new infections and 10 more Albertans died. Alberta now has the most active cases of any region in Canada, more than 16,600 active infections. There's fear a tsunami of patients is coming to hospitals where staff are already exhausted, running out of room, and facing life and death decisions. Heather Yourex-West has our top story tonight.
Inside the ICU at Edmonton's Royal Alexandra Hospital, patients are now being treated two to a room, part of a plan to find space for more COVID patients as the infection rate in Alberta continues to grow.
We're also maximizing our occupancy by cohorting patients, by using decommissioned spaces or other spaces that aren't being used at this point in time.
To prepare for the expected surge in patients, a memo sent out last Friday called for the conservation of oxygen at Calgary hospitals. Due to limitation of the bulk oxygen systems at some adult acute care sites in Calgary and the expected increase in demand due to the COVID-19 pandemic, we need to reduce the demand. The health system is working to open another 425 beds in the coming weeks, but even those beds could fill fast. There were 24 COVID patients in ICU on October 30th. That number doubled in 2 weeks, and 2 weeks later, it's doubled again. On Tuesday, Alberta's opposition leaked internal Alberta Health Services modeling that shows ICUs could see as many as 161 patients within 2 weeks' time.
The lengths of stay are not short, so when you have a lot of patients that are knocking on the door to come into the system and the ones that are there aren't ready to leave yet, that's where our challenges arise.
There's nothing that can be done today that is going to stop new admissions for the next 2 weeks. The big question is, how well will the restrictions work going forward?
New restrictions were announced last Tuesday, but not all measures took effect right away. If they work, new infection numbers should start to come down within the next week. But if they don't, there could be a steep price to pay.
If they are wrong, we are in a position where we have to bring in triage and triage tribunals. And that directly means choosing between who gets to live and who has to die.
It's a horrific worst-case scenario that becomes more plausible by the day. Heather Yourex-West, Global News, Calgary.
We know the virus is most lethal in elderly people. Across Canada, the majority of deaths have been people in long-term care. In BC, long-term care homes are again the centres of outbreaks. As Robin Gill explains, that has led to calls for a new approach.
It's never easy to put a family member in a care home. Even harder, keeping them there when a COVID-19 outbreak claims lives. But that's what has happened at the Delta View Centre in a suburb of Vancouver. Leslie Telford trusts the care her mother Sandy is getting there. She just doesn't trust how the virus is being controlled.
Within all of this, we really have to pay attention to their quality of life. That in the will for safety, we can't lock people away indefinitely.
There are 57 outbreaks involving long-term care facilities in British Columbia. The second wave is forcing them to take on desperate measures. Take this seniors home in Abbotsford, which cares for 700 residents. It's preparing for staff shortages by hiring the residents' family members to clean.
Today we're sitting with 14 positive staff and 12 positive residents. So these things, once they get into a care home, they take a life of their own.
The association overseeing care facilities in BC is led by a former provincial health minister. He's asking that rapid tests be introduced as extra protection.
We have the tests sitting and they're available. There just seems to be some resistance on the part of the provincial health officer and the ministry to go forward with this.
But the province doesn't think they're accurate, and that is frustrating BC's seniors advocate.
Remember that Christmas is coming, and for about a quarter of the people in long-term care, this will be their last Christmas. And we have to think about, should we not be using every tool in the toolbox that we have available to us to add layers of detection and protection?
If anyone should be worried, it's Leslie Telford.
This is the second outbreak, but it has been ongoing now for almost a month.
With no visitors allowed, she is one of many unable to see what's happening inside and the risks facing their loved ones. Robin Gill, Global News, Vancouver.